talk a little bit about the pain pump. Exactly what is a pain pump?
A pain pump is a device that's been used in a lot of surgical procedures, from hernia repair to knee surgery to podiatry surgery. We use it in plastic surgery. Not all plastic surgeons advocate it. I think it's an extra expense when you're talking about a cosmetic procedure that may be very expensive. However, I look at it and I say that when we do hip surgery for a patient, for example, we want them to get up and walk around that night after the surgery because their recovery is so much faster. So if you can use something to mitigate the discomfort that patients have right after surgery and get them moving again back into their routine, the recovery is much quicker. So that getting to the pain pump, it's just a device that is a container, and it has some numbing medicine in it. I also add a little bit of antibiotics as well. It's connected to a very fine tube or several tubes that actually go through a little tiny nick in the skin. And then the end of the tube has several holes on the side like a drip sprinkler. And it irrigates, for example, around a breast implant after a breast implant has been placed. Or it irrigates the area right in the center of where the muscle has been sewn together in a tummy tuck, which is the most uncomfortable part. And so patients really move about a lot more quickly. They recover faster, in my experience. I have many patients, in fact, essentially everyone who's had breast augmentation when I use the pain pump is able to raise their hands over their head the day after surgery, less than 24 hours afterwards, which is almost unheard of. If you've had anybody who's had breast augmentation in a traditional way, they tell you many times it takes 3 weeks to be able to do that. Well, in 3 weeks, your shoulders can get very stiff. And so it takes a lot of time to even work out the stiffness if you haven't raised your arms that high. So I think that it really helps people get back into living a lot more quickly, and takes it makes everything much quicker. They take fewer pain pills, and the downside of pain pills is constipation or lethargy or tiredness or any of those things. And so needing to take less medication is really an advantage as well.